Uh, Hello, everybody. My name is Alexander Unger, and I will give a presentation today about time perspective and psychopathology. So, first of all, here is an overview of my presentation. In the first part, I will introduce time perspectives and psychopathology together with a short introduction to time perspective theory as developed by Zimbardo and Boyd in 1999. In the second part, I will present time perspectives and burnout, some selected key research insights. And in the third part, the Zimbardo time perspective inventory and psychiatric disorders will be discussed according to the question of cause or consequence. So first of all, I start with time perspectives and psychopathology together with a short introduction to time perspective theory by Zimbardo and Boyd. The time perspective theory was suggested by Zimbardo and Boyd in 1999, and it's about that humans organize experiences into temporal categories which are past, present, and future. Furthermore, there are individual differences in time perspective which predict emotions, behavior, and cognitive processes. Furthermore, the concept of a balanced time perspective was developed, which is highly associated with states of well-being. The Zimbardo time perspective inventory, which is a standardized measure, measures 5 temporal orientations, which are past negative, past positive, present hedonistic, present fatalistic, and future. And this measurement instrument is widely used in clinical and personality research. So what is the time perspective? It's a psychological construct and deals about the question how individual portion attention across past, present, and future. There exists several subscales: past negative, past positive, present fatalistic, present hedonistic, and future. And there was also later another future time perspective labeled future negative, which is about fears and anxiety about the future. Furthermore, we have the construct of a balanced time perspective, BDP, which is an adaptive combination of subscales as developed by Stolarski and colleagues. So this CTPI measurement is widely used in research, and several short forms exist, and we have the concept of a deviation from a balanced time perspective, which is used typically in clinical samples to quantify imbalance. The psychometrics is a good across cultural comparisons, but we have to deal with the problem that several short versions exist, and time perspective was observed to highly associated with psychopathology. So cross-sectional studies show correlations between certain TP dimensions and mental health. In example, or most striking, high past negative is highly associated with depression, anxiety, and suicidality. And high present fatalistic was found to be connected to hopelessness. Low future is associated with impulsivity and poor self-regulation. Overall, studies suggest that TP distortions are linked to psychological distress, as observed by studies by Van Beek and colleagues in 2011 and Stolarski and colleagues in 2018. Now I will present some example studies. The first one is by Van Beek and colleagues from 2011. They compared 76 psychiatric patients and control participants, and the main results were that they observed significant associations between past negative, present fatalistic, and psychopathology. So there is some suggestive for associations in a correlative manner, but not yet causal evidence. Then we have some longitudinal studies and findings of mediation analysis. Some studies analyze TP as a mediator variable as Oyanadel and Buela-Casal in 2014 and Stolarski and colleagues in 2018. So, as an example, TP mediates the influence of chronotype as morningness versus eveningness on suicidality in bipolar disorder patients. Other studies explore TP predicting depressive symptoms over time, and there is some indicate that TP may influence vulnerability, but the causality underlying mechanisms remain unclear. Then we also have some neurobiological correlates. The studies link TP dimensions with gray matter volume of the brain and the neural connectivity, and these studies suggest the partial biological basis of TP profiles. But again, this does not imply causal directions between TP and mental illness directly, as a study has shown by Zhang and colleagues in 2013. Furthermore, we also have representative clinical findings which show that high PAS negative consistently correlates with depression, personality, pathology, and suicidality. Present fatalistic is linked to poorer outcomes and weaker therapeutic alliance and therapeutic success. A balanced time perspective is associated with better quality of life and functioning in general, as shown studies by Van Beek 2011 and Oyanadel and colleagues in 2014, as well as by the Diapason study in 2023. Then here you can see some patterns across studies. So we can summarize that PAS negative shows the strongest and most consistent associations with psychopathology. Present fatalistic is often associated with hopelessness, suicidality, and poorer alliance in therapeutical treatments. Then we have also the observation that future orientations sometimes are protective, but here we have mixed findings across different samples. According to mediation analysis and mechanism, TP can mediate relationships between biological behavioral variables and corresponding outcomes, as already mentioned in the case of chronotypes and suicidality. And we can assume the following mechanism: cognitive appraisals of past events, perceived agency and present goal directness for the future. Then we can summarize further that there is a clinical relevance. TP is modifiable and changeable, so we can assume a potential therapeutic target here, as been shown by studies by Karatuch and colleagues in 2022 and in 2024. There are also other mediation studies showing similar pattern results. In example, when we have a look at the Karatuch study from 2022, we can see here that TP mediates the direct influence of chronotypes on suicidal ideations. So here I will give a summary about time perspectives in severe mental illness. Studies in schizophrenia and bipolar samples show that the deviation from a balanced time perspective is associated with symptom severity and functioning. TP predicts daily time use and therapeutic engagement. The assessment of TP may inform individualized rehabilitation planning, as shown by a study by Sapo and colleagues, 2023 and 2025. Psychological domains, this is about isolation and anxiety. Past negative and present fatalistic relate to higher perceived social isolation and social interaction anxiety. Positive in turn is linked to lower anxiety and greater social connectedness. TP are relevant beyond symptom scales and impacts the social functioning and the quality of life. Here we have the clinical implications and possible intervention possibilities. The CTPI can be used as an assessment tool, and intervention targets can be that to increase past positive, enhance future orientation, and reduce present fatalistic. In some cases, as post-traumatic stress disorder or in the case of depressions, the increase of present hedonism can be helpful. In other cases, the decrease of present hedonism is helpful. And this is the case when it's about alcohol or related addictions. Approaches related to the CTPE therapeutical approaches can be cognitive restructuring, imagery rescripting, goal setting, and time perspective training. All this has been shown to be effectful in a combination. So the limitations and future research are the following. Most evidence is cross-sectional, so we have limited causal inference, and the samples are very heterogeneous. So we have clinical and non-clinical samples. So there is a recommendation to conduct more longitudinal intervention and mechanism focused research. So I will come now to time perspectives and burnout and will present some key research insights about this part of research. Though there is one of my own studies from 2022. I will not go into the details here, but present the main results. And the main results are that the direct influences of the deviation from a negative time perspective is fully on the three components of the Maslach burnout inventory are fully mediated by perceived stress and self-efficacy. Furthermore, there is a study by Klamut and colleagues, and they have observed some similar results. And the key finding we can summarize here that the balanced time perspective is negatively related to emotional exhaustion and positively to personal achievement, and there was no effect on depersonalization. Then there is another study from Spain by Raik Botella and colleagues from 2021. And the key findings are here that negative past, present fatalistic, and negative future increase burnout tendency in the case of shipyard workers. Another study by Xier and colleagues from 2024 shows some very similar observations that future time perspective partially mediates the effect of self-efficacy on burnout tendencies. So here is the summary of these key studies. Time perspective influences burnout across healthcare, corporate, and blue-collar settings. Negative past, present fatalistic perspectives are risk factors for burnout. Balanced time perspective and future time perspectives can be seen as a protective factors. And self-efficacy is a key mediator in reducing burnout. And on the practical side, we can develop interventions which can try to increase self-efficacy and train time perspectives. So I come now to the last part, the Zimbardo time perspective inventory and psychiatric disorders, cause or consequence. So does distorted time perspective cause mental illness, or is it a consequence? So we have here the large problem that most of the studies are cross-sectional data, and this cannot test for causation. So we can assume here possible bidirectional relationships, that psychopathology alters time perspectives and vice versa. So pre-existing time perspectives can have an influence on the cognitive style, and in turn influence or increase or decrease the vulnerability to disorders. And the disorder onset can in turn alter the perception of time, and this can be understood as a time perspective shift, as already discussed in the time perspective research literature. And we can here assume a reciprocal reinforcement over time, which can also be applied in therapeutical settings. So what is needed here are longitudinal and also experimental studies. So these are the methodological challenges: the lack of longitudinal data, baseline TP before illness and afterwards. We have the existence of confounding variables, personality, life events, and neurological factors. We also have to deal with partially small sample sizes and clinical heterogeneity. So we have hitherto limited intervention studies targeting time perspectives directly. So future research directions can be longitudinal cohort designs tracking TP and mental health over time, the experimental manipulation of time perspectives, the integration with neuroimaging and psychophysiological measures, and also the examination of the protective role of balanced time perspectives. Clinical implications can be TP could serve as a psychological marker or resilience factor. TP-based interventions may enhance well-being and treatment outcomes, and promising integration with CBT and mindfulness approaches. So as a summary, CTPI reveals systematic pattern linking time orientations to psychopathology, and there is evidence which supports the association and not definitive causality. TP likely acts as a marker modulator and can be understood as a bidirectional factor. Distorted time perspectives are consistently related to psychiatric symptoms. Current evidence supports correlational, not causal interpretations. Prospective multi-method studies are essential for the testing of causation. So I thank you very much and hope you get some insights from my presentation about time perspective and psychopathology. Thank you very much.